Good afternoon. Welcome to Bariatric Friday. This is American Surgery Center. My name is Kemal Erkan. I am actually here with Dr. Isaias Irgau, and Dr. Irgau is in the Surgery Center, I guess. So, Dr. Irgau, how are you doing?
I'm doing great, Kemal. Sorry to delay you. I guess I was not in my usual setup, but
No, that's all right.
didn't work completely. So thanks to James, he saved the day.
Well, that's great. So, so this is part of the maybe what makes this session unique because, well, I don't provide any clinical advice, so we have a real surgeon, not just a real surgeon, one of the best in the world, is giving this information, the information that we are going to share with our patients. Well, when you have to get the information from the best, sometimes you'll have these difficulties, right? So we are happy that you are able to join us, Dr. Irgau.
Thank you, Kemal.
So, as usual, we divide the topics into smaller segments, and then we can process it easier for our patients who are dealing with morbid obesity. And if they decide to go with bariatric surgery, there are certain things needs to be done. So those are the topics that we are discussing. And today we are going to discuss the multivitamin use and how it's related to the bariatric surgery. And of course, I'm going to have Dr. Irgau to explain that to us.
Absolutely, Kemal. So essentially, micronutrients and vitamins are essential components of our nutrition that we need in very, very small amounts, right? So the amount we need them for is very, very small compared to the macronutrients, whether it's the proteins, the carbohydrates, and the fats, but they're extremely essential to us. They're essential for the function of many, many cellular activities. And if we don't have them, obviously we become ill, right? And throughout our evolution, we have evolved this body, this physiology that we have alongside with our environment. So our environment was providing everything that we needed, right? And, as long as we were eating food directly from the source, there was no problem of having vitamins, right? But as, we become more and more detached from the source of our nutrition, right? Many of these macronutrients were not readily available in the food that we find, stored and processed, right? So unless we get them separately in adequate quantities, we can get ill as well, right? Now, why is this even more important after bariatric surgery? Well, after bariatric surgery, this is very important because bariatric surgery itself, by the changes it results in our digestive system, it interferes with our ability to absorb what we eat, right? And particularly with some procedures that we call malabsorptive procedures, because there is rerouting of the intestine, particularly with those procedures like gastric bypass and duodenal switch, especially, this problem can become even more acute. So unless we prepare our patients adequately with education and with providing resources on the importance of taking vitamins and certain other micronutrients after surgery, our patients are in danger of becoming ill after bariatric surgery. So multivitamins and micronutrients are important even without bariatric surgery, but they are extremely important after bariatric surgery because of the interference of bariatric surgery with our digestive system, essentially.
So the main difference that we have here is that this is more important post-surgery. So we just want to emphasize that because prior to that, not necessarily because someone just eat more doesn't mean that they have more vitamin, but it's not a problem at that point as big a problem as it's after the surgery, because now we are going to lose weight.
Yes.
And we're going to lose weight with a lot less food. And then therefore the body still needs certain things and then we can even get what we need to get it from. Even if we eat proportionate amounts, we still can't get the actual vitamin. That's these are not fresh, right? So we already lose a lot of value by the time they come to our table. So my classic that I'm going to probably say here is, well, I take multivitamin daily, and I'm not post bariatric surgery patient. So one really important issue for our patients to understand is this is not just for you. I mean, even if you weren't going to get the surgery, because we discussed this, I think, last year, Dr. Irgau, when you told me you were shocked that I wasn't taking daily vitamin. So I started taking it, but then guess what I did next? So I want to make sure my entire family, everyone, is doing the same. Yep. Because they weren't either. So, and then they're not going through the bariatric surgery, or they're not post-bariatric surgery. So this is needed for everyone.
Absolutely.
That's kind of like the key, so that don't feel like you are the only one who has to do this because you are having the surgery. No, you just need to, you may be more vulnerable, but that doesn't mean that you shouldn't be taking it if you are not getting through the surgery. You should still get these vitamins, because we are not able to get them from the actual food that we are eating, and that support is going to be extremely important.
Absolutely, absolutely. So our diets in our modern society may not be varied enough for us to have the different micronutrients and vitamins that are necessary, right? But on top of that, as you said, a lot of the foods that we eat in our modern society are removed from their actual source, right? We don't have generally a garden that we go to in the back of our house and pick the food right from the ground or right from the tree, right? We go to the store. And the food that we find in the store might have been picked from its source maybe months, weeks before it gets to our store, right? So a lot of the food actually loses that valued micronutrient quantity that our body needs, right? So because of that, in our modern society, all of us will require multivitamins for us to stay healthy in general terms. But why is this even more acute after bariatric surgery, Kemal? It is more acute because our ability to process and to absorb has been altered by bariatric surgery. The classic example would be gastric bypass. Now, what have we done with gastric bypass? We have rerouted the intestine in such a way that the most active portion of our intestine, when it comes to digesting, processing, and absorbing nutrients, has been secluded from the food itself. The food will never come to that early intestine. It will find a different path. So that very active portion of our intestine is not available to help us absorb all the nutrients we need, right? That's what gastric bypass does. In which case, even if we were taking normal multivitamins, that may not be enough for us to get everything that we need. Because of that, especially when it comes to certain vitamins, bariatric surgery, patients must take them in addition to their multivitamins. And I'm here talking about vitamins, but I should also be talking about micronutrients in general, certain minerals, right? Like calcium, like iron, like copper, like zinc, for instance. These are very, very important as well.
Well, now, so let me just remind something, so that what happens when we don't take, so that you can actually continue with that. So when we don't have enough vitamins, so when we don't consume enough, we are going to have fatigue, feeling tired, anemia, the bone and muscle loss, impaired night vision, low immunity, loss of nerve function, and mental function deficit. So these are like indicators in some ways, but we don't want to get to this. Maybe like fatigue is fine, that you are feeling tired, and then you can, but if it's at the mental function deficit, and it may be not reversible, right? So that's kind of like important. So if you have these, even today, and anyone who's watching this, I know that there are people who are not going through the surgery are also watching this. So early on, getting these vitamins and start using it is important. Of course, you need to maybe talk to your primary care physician, make sure that they're on board. You have your blood work already done, so then they can check. This is why the annual physicals and the blood work is important with that, because this is the only way that we can actually find out these issues. But didn't want to interrupt you, but I think this is important for them to know. These are the potential risks of not having enough.
Yes. I mean, you said something very important. You said certain changes may not be reversible, right? Mm-hmm. There is real danger. For instance, if people lack things like vitamin B12 or vitamin B1, also known as thiamine, and if they don't have those vitamins for a long period of time and they are depleted, they can have serious neurological problems that may not be curable, right? Which means loss of memory, loss of ability to walk and to do things, right? So these are serious consequences, and we absolutely must educate our bariatric patients about the importance of taking these vitamins for the rest of their life, but also more importantly, Kemal, for them to follow up on a regular basis with their bariatric practice so that blood work can be done on a timely fashion to really make sure that they're not deficient on these vitamins, and that if there is a hint of deficiency, that can be addressed in a timely fashion. One of the deficiencies that we see, for instance, is vitamin D, very, very commonly seen, particularly in young women in this country. This is even before bariatric surgery. Now, not having enough sufficient vitamin D in association with lack of calcium can lead to problems that affect their bone health, right? And in the long term, that could be devastating. So they have to take additional calcium. They have to take additional vitamin D. And then we have to continue doing blood tests to make sure that their levels are adequate, so that if we see that they are falling behind, we can supplement them with a short-term course of high doses of these vitamins so that they can replenish their stores again, right? So when we are doing bariatric surgery, our intention is obviously to address obesity, right? But the consequence of our surgery also can lead to other problems. And if we're not adequately prepared for that, then we may create problems that may be even worse than obesity, which is the problem that we set out to correct in the first place, right? Also, this is very important. We are undertaking surgery so that people will lose weight and become healthy, so they don't have diabetes, so they don't have high blood pressure, so they don't have sleep apnea. But also, we're inducing certain changes that put them at risk of deficiency. And if we don't prepare them adequately for that, then they can end up having problems which are, significant, and if sometimes even worse than the obesity itself. So it is incumbent upon us as bariatric surgeons, to absolutely educate our patients, but also give them the tools necessary, right? Show them what kind of vitamins they need for them to stay current, and also make sure that they come back on a regular basis for us to be able to check on this, right? Now, one of the questions that comes very, very commonly, Kemal, is that, people say, oh, well, can I take this multivitamin that is a tablet, or can I take this one that is chewable, or can I take it in a liquid form, right? All those things we can discuss, right? At the end of the day, what we want people to be compliant with our recommendations. So if we say you have to take this pill, and then the pill is too big and they don't want to take it, then we have not succeeded, right? But then if we give them options, for instance, if chewable is better tolerated by them, then we go with the chewable. We just have to make sure that all the necessary vitamins and micronutrients are available in that form, right? And there are certain...
Maybe this is one of the channels that we actually discuss this, but our patients also really need to understand there is a major undertaking when we are going through the surgery. So now, I was just looking at my activity because from our last week, I have a couple projects for us that I'm going to share. Mm-hmm. But in the meantime, I'm actually looking at what I'm doing. So and openly I discuss my own issues now, since we have our own channel. Well, you missed the earlier session, so you'll catch up. So
I did catch some of it, Kemal. I did catch, and I have to tell you, you said my book is going to be better than yours. That's not true. Our books are different, right? But yours is just as good, because I know you are a fantastic storyteller. And you are a good document holder, right, Kemal? So I know I'm waiting for your book.
I wasn't actually worried about that, but what I was saying that now I share everything openly because we have this channel. So I lost a little bit again. Before it would never happen, right? But one thing is important. I think last week with Dr. Sachin made with the colorectal, I guess if someone doesn't come out and talk about the issues, people think that no one is having these issues. That's not true. So after pandemic, most people did gain weight, so including myself. So I know I have extra 20 pounds, minimum 20 pounds, maybe that doesn't belong to me. The thing is, in order to lose it, you have to have a really good discipline. So surgery is not an option for me. My BMI is about 28, maybe 28 and a half. Hopefully it's not more. But it's tough. Like this is each day you see here. So this is yesterday, that's 11,000 steps. That requires for me to put extra effort to go out and force myself to walk. Mm-hmm. Now, the week before is the day before is 98, the day before is 94. I don't know how I did this, but good job. On, I think Sunday I did 13,600. And the change doesn't happen. I don't see some effect right away just because I'm doing this, because I've been doing this. So it's like, it's there anyway.
Yes.
So I'm someone who plays twice a week tennis, walks this much. And now where I am, challenge, struggle, right? So now why I'm giving all this is because if someone is going through a bariatric surgery, and understanding that this is the most effective, most efficient treatment for morbid obesity, but we also have to own some of the, we have to take some ownership on the issues. There are certain things that we cannot control, fine, because it's a chronic illness, but there are certain things we can control. Mm-hmm. So how we are managing that chronic illness and how we can actually impact someone's life with the surgery, but we don't want that to be just acute change. We want that to be a permanent change. Yes. And vitamin utilization, using daily vitamin is a key, so that you don't actually get into any other health issues. Because you, even without, again, morbid obesity, you can have these problems. But the list that I shared earlier, protein, calcium, vitamin D, B complex, the folic acid, vitamin A, iron, vitamin K, vitamin E, zinc, copper, all these, if you had 3-4 of them prior to COVID, you would have a less, your COVID would be less severe than it is, because you have to take zinc and vitamin D and vitamin, at least 3-4 of them. I'm looking at the list. So this is already preventive for us. Mm-hmm. So now, because there's a big change in our patient's life, so they need to really understand, okay, this is important. So you have to really take this seriously. You cannot not come to your post-op visits. You have to show up for your post-op visit. You have to follow these instructions, because this is not because you're a patient of bariatric surgery. It's because you are a human.
Absolutely.
So that's all we need to come to the understanding of this. So then we can have a successful outcome, a permanent outcome. So it's not just successful one time, but it's permanent. So that's why we are trying to put a lot of emphasis on these.
Yes. So clearly, Kemal, there is a fair amount of obligation after bariatric surgery from the patient's point of view for them to stay healthy after done bariatric surgery. This is critically important. In other words, it should not be a flyby where you have the surgery and then you disappear as if, going back to to your life without really any regard of the important changes that have happened to your body, and therefore at the obligations that you have to make sure you stay healthy, right? These are important things that come about, right? One of the interesting discussions we often have with bariatric surgery patients, Kemal, is the reaction of other people towards bariatric surgery, right? They would say, well, I did consider bariatric surgery for many years, but I never really came for the consultation or decided to go ahead because I thought that bariatric surgery was a cop-out because people felt that this was an easy way out. Mm-hmm. Nothing is further from the truth, Kemal. Bariatric surgery is not an easy way out at all. It requires enormous effort and determination and, to go ahead with the surgery to begin with, but also to undertake a commitment after surgery to stay healthy, right? So it's not an easy way out by any means at all. Bariatric surgery is a really major undertaking and major responsibility when you decide to go through it, right? But it also
that term now you are saying that, and I do hear that time to time, and I mean, forgive me for saying that, but I think if people think that doing something is the easy way out, I think they are undermining certain things. They may not be so smart. Like why would I not do the easiest one if it's effective? So why do I have to go to the hard way? Because hard way may not be the possible way. So
right.
like I go to New York, like do I take train or the plane or the car or do I walk? So you want me to walk to New York every time I have to go to New York because just getting to Amtrak with the SL Express, that's the easy way out because it's 1 hour and 30 minutes. Why not?
Yes, absolutely.
So it's the efficiency of it, effectiveness of it. So I think that most people really, they don't understand, again, the chronic illness that we are discussing. And then they think that this person doesn't go to YMCA and then doesn't do extra 3-hour exercise. That's not what we are discussing here.
Absolutely. And also because, the first thing that comes to their mind when they think about obesity is willpower. They think it's all about willpower, right? But it's not true, Kemal. The people, that we see in our practice are people who are accomplished in many areas of their lives that require extreme willpower, whether it's in education, whether it's at work or others, right, Kemal? But when it comes to losing weight, then they cannot do it. And they cannot do it because it's not just about willpower, because they are fighting a biology which is so entrenched that it is very hard. That's why we say bariatric surgery is a very, very efficient way of doing it, because only bariatric surgery can break that vicious cycle where your body, every time you diet and do other things, it resets itself, and then you end up always failing, essentially, right? So bariatric surgery, we do it because it's the most effective treatment we have for this very serious issue, which is morbid obesity. But if people don't look at morbid obesity as a serious medical problem, as a health problem, right? If they don't equate it to serious illnesses like cancer and others, if they only think it's about willpower, then they will talk about, easy way out or a cop-out when it comes to bariatric surgery. But the point essentially I'm trying to make here, Kemal, is that when a person commits themselves to bariatric surgery, they commit to a lifetime of change that it will be critical to adhere to for them to stay healthy, right? We're not just talking about the fact that they have to maintain a certain rigor when it comes to their eating habits, their physical activity. We're saying, look, you're also at risk for vitamin deficiency because of the changes that your body has undergone. So you must be cognizant of this fact and follow all the instructions we give you about the need to take extra calcium, about the need to take vitamin D, about the need to take vitamin B12, and all other nutrients that are very important. So this is an important topic for bariatric surgery. We cannot practice bariatric surgery without really talking about, the need to stay current with multivitamins, because that could create serious problems in the long term. Now, it is important here to emphasize that not all bariatric surgeries are equal when it comes to their impact on vitamin deficiency and vitamin need, right? We talked about this many times. For instance, procedures like the gastric sleeve, for instance, right? Where all we're doing is really removing a portion of the stomach. Is different from gastric bypass, where not only we're dividing the stomach, but we are rerouting the intestine, right? With gastric sleeve, once the food leaves the stomach, the food is processed normally in the rest of the intestine. So with the gastric sleeve, there is going to be less tendency for vitamin deficiency compared to gastric bypass, where the problem may be much more acute, right? It is important.
One of my friends is asking, why are you using like the OR background? And I'm like, I asked James to come to you. So it's not a background. So it's not a virtual background.
No. This is
So
the real
OR.
I can tell you what the reason is, Kemal, actually, and I don't have any problem. My usual setup place, there is some construction going around it. So there was a lot of noise. So I knew that would be very, very disruptive. So I decided to come to the OR and do it because obviously,
it's quiet. It's fake. So.
Do they want to bring one of the slides?
I asked James to just walk in so then they can see, but James is not there. Maybe he'll see it.
No, it's not a fake background. This is actually all very real. There is an operating room here. These are the lights.
There, see? No.
So it's not fake at all. We're not that good at faking things. So going back, essentially, Kemal, I do want to emphasize that although there are differences when it comes to need of multivitamins between gastric bypass and sleep, for instance, it is important to understand that even if you have the sleep, you still could have some alteration in your ability to process some micronutrients. Even things like B12, for instance, for us to be able to absorb the B12 well, we need something called the intrinsic factor, which is really now we're real, right?
Nothing.
Thank you. So intrinsic factor, which is something that is found in our stomach, and because we're removing a big portion of the stomach, we could still be potentially deficient of B12 as well. Now, this problem is not as acute as it is with gastric bypass. What I want to emphasize that with all bariatric surgeries, it is possible to have some deficiency of micronutrients and vitamins. And it's important that patients are screened for deficiency the first time, right? For instance, as you see in case conferences, all our patients have blood work when they first get to our consultation, and we check them for possibility of diabetes by checking the hemoglobin A1C, possibility of thyroid disease by checking the TSH, but we check B12 level, we check folate level, we check vitamin D level, and sometimes even thiamine level as a baseline, okay? And then, so if they walk into our program before bariatric surgery with any of these deficiencies, they are going to be at a huge disadvantage to begin with. So we make sure that they are supplemented earlier on so that when they have bariatric surgery, they're not going to be at such disadvantage.
Absolutely. And again, we want to make sure that just maybe I'm going to repeat what I said earlier. There are things that we can control and there are things that we cannot. We'll take care of those, what we cannot control with surgery. But what you can control, you have to own the accountability. You have to become more accountable. So this requires changes. Now, I have to say, most of our patients, they already made this really important decision. That means they are taking this very seriously. Yes. So we want them to be successful for long term. So, it's never good to see a patient who had surgery 3 years ago. Not only they didn't lose any weight, but then they had complications. We don't want to have that. And that's preventable.
Yes.
By following up with this, regular visits and following the instruction that we are providing. And hopefully we are, again, reaching out to so many individuals. And just maybe if someone joined the call later, so we are mainly focusing on the post-surgery part of it. So it's still important, but post-surgery is the most important for us.
Absolutely.
Dr. Thank you so much for joining us. And I know you are in the middle of a patient there, but again, that makes this more important, so that we not only I take it seriously. I know you are taking seriously, not just for you, but on behalf of our surgeons at CHRIAS.
Yep.
And we appreciate that. Thank you for joining us today, and then we'll be back next week.